All right, welcome back, everybody. As promised, we're going to do an upper extremity foam rolling session. So, a little bit about foam rolling. If you want to know more about that, just click on the first one for the lower extremity and a little bit of the science behind it. But starting with upper extremity, we're going to start off sitting on the foam roller, where we kind of left off. Now, there's a couple different, basically this is going to be for the spine, okay? But the thing you got to remember is the back muscles are big and deep in layers. So we need to figure out a way to open up the spine a little bit, get some manipulations in there, which is, cracking your back, and then kind of reaching layers that may be beneath the big, latissimus dorsi or the lats, or some of the erector spinae muscles and things like that. So the first one that I do is simply sitting on the foam roller. I usually will have either shoes off or shoes on, but not socks, because you don't get a very good grip. And for the way I like to do these, again, movement, warm up, blood flow type things, you need to be able to get a good grip with your heels, okay? Because that's going to control your body position. So getting into it, I walk down a little bit, okay? And as I'm walking down, I can feel that foam roller putting the pressure into my spine. Just down, okay? And then extend your legs again. So now I'm not back with my butt on, I'm on my lumbar spine or my low back, okay? So now I can just go here a few times, for reps, maybe 10 reps, 30 seconds, 60 seconds, whatever you want to do. But then as you come back up, the next transition here is I like to put my arms out like this. And again, same thing, I've tightened my back. So now I'm getting a very superficial roll where it's just the skin on the muscle. After a couple reps of this, I then will go into like a T position. That kind of moves my shoulder blades a little bit. And there we go, it's got a couple nips. All right. Next one I'll do, let me move back down just so we're seeing the picture. Next one I'll do is kind of arms across the chest like this, and I'll take a deep breath in and hold it. Okay, what that does is it kind of fully expands my rib cage, gets my lungs full, and really increases my intra-abdominal pressure. So it puts pressure on your spine and on those muscles from the inside out. And the foam roller is putting pressure from the outside in. So it's really kind of putting some force on those joints and really making them become a little bit more mobile if they're not mobile to begin with. The next one I'll have to explain first is we now are coming from our fully expanded, holding our breath, to trying to expel all of our air, okay? And that's going to do something similar. We're going to decrease all of our intra-abdominal pressure and allow that foam roller to really put a lot of pressure into the spine and hopefully get a little manip or a little crack in there to get some movement. So again, starting from here. All right, good. So those are pretty much the ones for the spine. So remember, normal, just up and down, kind of warm the tissue up, get some blood flow. Arms out straight, tightens the back, really gets a nice superficial roll, gets the tissue near the surface. A T fashion kind of moves the shoulder blades, unlocks the back a little bit, allows you to get a little bit more depth. And then arms across the chest, full expansion, hold it for as long as you can, up and down, up and down, up and down. Change your rate, go fast, go slow, find a spot that you need to work on a little bit and just hold right there. And then the last one there would be fully expel all of your air, go up and down, nice and slow, and you're going to feel those layers of the back start to like crack as you go up and down. The last one I want to get to in this video is going to be the lat. So again, this one's going to be almost like the IT band for the lower extremity, but it's your lat. It's the big muscle underneath the shoulder kind of here. And so with this one, again, since since we don't really need our hips off the ground too much, but we do want this to be stable. So I just put my hand on my head, right? So, and I start with the foam roller at the base of the shoulder blade or the bottom of the lat, and then just roll up into the armpit, okay? Roll back up, right? And so my hand here is on my scapular, my shoulder blade. So just for demonstration, you can see how I roll away from it into the armpit, and I roll back up to the hand, all right? So again, that's your lat muscle, your latissimus dorsi in the back, and that's a really important muscle for any form of athletics, especially throwers and racket sports and things of that nature. So I have a couple more in mind that I'll probably do in another video, a little more with some shoulder opening and things of that nature. But for now, that would be the upper extremity spine and